Have you been curious about testosterone therapy and wondering if it might be for you? Perhaps you might be noticing decreased muscle gain, low libido, fatigue, or erectile dysfunction. You might be wondering if your testosterone levels might have something to do with all this. Hi, I'm Dr. Esra Shermadou. I'm a board-certified family medicine physician, and in this video, we'll be breaking down the facts about testosterone, what it is, what happens when it drops, and what you can do about it. So, what is testosterone and why is it important? Testosterone is the primary sex hormone in males. Over 90% of testosterone is produced by the Leydig cells in the testes, with the remaining small amount produced by the adrenal glands. Testosterone is responsible for the development of the male reproductive organs during fetal development and the physical changes that occur during puberty. In adult males, testosterone is responsible for supporting muscle mass and bone density, spermatogenesis, libido, mood, energy levels, and many other functions. For adult men, normal testosterone levels typically range between 300 to 1,000 nanograms per deciliter. Levels naturally decline with age, starting around age 40, dropping roughly 1 to 2% per year. The decline is more pronounced in some males compared to others, and when combined with symptoms of low testosterone, results in a condition known as hypogonadism. The most common cause of acquired low testosterone is simply aging, but it can also result from obesity, chronic stress, sleep apnea, diabetes, certain medications, and even past trauma or infections involving the testicles. Often, it can be a combination of these factors. Some of the most common signs or symptoms of low testosterone include low energy, decreased sex drive, and a decrease in spontaneous erections like morning and nocturnal erections. Other symptoms include weight gain, particularly around the midsection, decreased muscle mass, and emotional irritability, depression, and memory changes. These symptoms often come on gradually, making them easy to dismiss until they start affecting your daily life. Diagnosing low testosterone requires both lab testing and a clinical review of symptoms. In men younger than 45, testosterone levels follow a diurnal pattern, typically peaking in the early morning and gradually declining throughout the day. Because of this, it is recommended that testosterone levels are checked in the morning when levels are highest. This is checked on 2 separate occasions as testosterone levels can fluctuate. Other labs that might be evaluated include PSA, looking at your prostate, hematocrit, and a lipid panel to ensure a safe starting point for any potential therapy. Before jumping into testosterone replacement therapy, or TRT, it's important to address foundational lifestyle habits. Sleep, diet, strength training, and stress management, all of these can significantly help support natural testosterone production. But when lifestyle isn't enough, testosterone replacement therapy may be considered. Options include injections, gels, patches, nasal sprays, or implanted pellets. The choice depends on lifestyle, tolerance, cost, and other potential factors, so it's important to discuss all these options with your provider. When testosterone replacement therapy is appropriate, many men experience significant improvements like increased energy, better mood, improved libido, more muscle mass, and less belly fat. Some benefits may appear within weeks, while others can take several months. It's not a quick fix, but it can be a meaningful part of a bigger health transformation alongside other lifestyle changes. TRT, however, isn't without risks. It can lead to acne, water retention, increased red blood cell count, and potentially worsen sleep apnea. Another great concern is decreased fertility, as exogenous testosterone therapy causes suppression of normal sperm production. So if pregnancy is desired in the future, this must be discussed with your medical provider. Testosterone therapy may also require regular monitoring of prostate health. Testosterone therapy does not cause prostate cancer. However, because there are testosterone receptors on the prostate gland, TRT can cause an expected initial increase in your PSA, but this will stabilize when testosterone receptors are saturated. All of this is why it's critical to work with a provider who regularly monitors labs and adjusts treatment as needed. So we've discussed many of the benefits of TRT and some of the side effects and risks. Now we will discuss who is not a candidate for treatment. If you have uncontrolled heart failure or heart disease, you would not be a candidate for TRT. Several large studies have shown that TRT does not increase major cardiovascular risk. However, it can cause fluid retention, which can exacerbate your pre-existing cardiovascular disease if it's not controlled. If you have uncontrolled sleep apnea, so if you snore loudly or have been told that you stop breathing at night, you will want to get a sleep study test and, if indicate, get started on CPAP to get your sleep apnea under control before starting on TRT. If you have active prostate cancer, You also are not a candidate for TRT, as this may worsen your prostate cancer. Once you are completely treated and cancer-free, TRT can be considered as an option after discussion with your doctor. So, as stated before, if you're on TRT, regular follow-ups are non-negotiable. That includes reviewing your symptoms and checking testosterone levels, hematocrit, PSA, and metabolic markers every 3 to 6 months. This ensures that your therapy remains effective and safe over time. Open communication with your provider is key. Some men explore alternatives to direct testosterone replacement. These may include medications like clomiphene and HCG, which stimulate your body to produce more testosterone on its own. These can be options when fertility and pregnancy are desired, or to help manage side effects of TRT. Again, lifestyle remains a big foundation of hormonal health and should continue to be optimized and maintained throughout treatment. So, if you're feeling off, talk to your doctor. This can be due to testosterone, other factors, or a combination of different things. Low testosterone is common, and it's also manageable with the right approach. Talk to a provider who takes your concerns seriously and will partner with you to get to the root of the issue. If this video is helpful, give it a like, subscribe for more on men's health, and drop your questions in the comments. That's it for now.